Hi, my name is Sain. I'm going to be a nurse today. I'm going to perform the newborn assessment on your baby. Your baby was born yesterday. Let me double check the ID band. Just make sure it's the right one. Right, the name and the date of birth. Right, it's the right baby. All right, everything matches. All right, before I do the assessment, I need to talk about that your baby has your baby's accuracy score is 9 at 1 minute and 5 minutes. When he was born, because his heart rate is over 100 per minute, he has very regular and well crying, and his extremities well flexed. And when we rubbing his sort of feet, he respond with cry. That's very good. But his skin is not completely pink. That's why he lost 1 point from that. All right. And today we're gonna do another assessment on your baby. Right, before everything, I need to sanitize my hands and don gloves. Before I unwrap the baby, I need to assess the skin color and respiratory effort. All right, your baby's skin today is pink, it's totally pink. And okay, let me take the vital sign for your baby. Okay. Okay. Right, the baby heart rate is 120 per minute, and his respiratory rate is 42. And let me check his temperature. And his temperature is 97.8 Fahrenheit. It's very important to maintain the temperature for the baby at all time. All right. Now we're gonna assess the newborn of the physical maturity. Let me measure the length. How to measure his length from the head to the heel. All right, your baby's length is 48 centimeter, and I'm gonna measure his head circumference. Right, like this. Right, his head circumference is 35 centimeter, and his chest, we're gonna measure from the nipple line, right? So his chest is 33 centimeter, right? And we need to check the skin. His skin is wrinkled, and his laryngol, he has a very fine hair. It's a lot of hair. Yeah, and check his plantar surface is scissor creases all over the entire sole of the feet. And need to assess the breast. His if you have a rise to full velar with the breast buds. And you see his ears. His ear have a very well curved pinna with firm cartilage. And then see his genital. Right, that his testes discerned and visible on the scrotum. It's very good. And then after the assessment, we need to return him to his mother to perform the skin to skin contact. Yeah. All right. Hi, my name is Sain. I'm going to be a nurse today. I'm going to perform the postpartum assessment on you. So just check out the head to toe and make sure everything is okay. Can you tell me your name and date of birth for me? All right. The name is Jessica White, January 18, 1987. And I double checked the ID band. Right, thank you for that. All matches. And I asked, do you have any allergies? Right, she said no, so no allergies. Right, then I sanitize my hands and don gloves. I will take the vital sign first. Okay, take the vital sign, and her vital sign is her heart rate is 86 per minute, and her respiratory rate is 18 per minute, and her blood pressure is 122/85, and her oxygen sac is 97%. That's all within the normal range. Now we start with some general questions and ask how you're feeling today. Do you have any pain today? From 0 to 10, 10 is the worst. And Jessica said it's 6 out of 10. because the trauma from the delivery, and she requests for the pain medication. And I'm gonna say, let me finish the assessment and then check for the provider's order. Then I will give you the pain medication. All right. Then I'm gonna ask the patient if they have any headache, any blurry vision, or any dizziness, and that will indicate preeclampsia. And she said no. And now we go on the heart and lung system. Let me hear for the stethoscope and hear the heart sound. Okay, her heart sound. S1, S2 is present, it's clear and regular. There's no murmur. And gonna hear the lung sound. Right, the lung sound is clear, symmetric, no wheezing. All right, everything's good. Now we're gonna assess the breast. I'm gonna ask Jessica, are you breastfeeding? And she said yes. And I asked if she successfully did the feeding and how she feel. She said everything did well and smooth. Then we palpate the breast and palpate the breast. The breast is soft. Right, there's no more fighting. Then we check on the nipple, and her nipples is symmetric on both sides, intact, no cracks, no trauma, no abnormal discharge. All right, now we move on the upper extremities. Right, I check the radial pulse. The both pulse is present, and check the capital refills. Good. Less than 3 seconds. And Jessica has the IV side, the IV on her. Then we need to assess the IV side, see if any redness, any swelling or infiltration. Also, we need to double check the fluid she is taking to make sure she is the right patient and she has taken the right medication, right dose, right route, right time, and do the right documentation. Now we're gonna move on the lower extremities, and we need to know the pedal pulse is right, it's present, and the capillary refill, right, is less than 3 seconds. And then we assess the skin, if any edema. All right, any edema? No, there's no edema on the lower extremities. Then we check the reflex on the lower extremity, both present and no hyper reaction. Then we check on the GI check, the GI system. We just generally expose the belly to see if any redness or bruise, and ask the client when is the last bowel movement, and she said the last bowel movement is in the morning. Now we use the stethoscope to hear the bowel sound from right lower quadrant, the right lower quadrant to the upper, and the upper to the lower to the lower left quadrant. Okay, then after we did the bowel sound assessment, we gonna palpate the patient, right, to see any tenderness, any pain. Also palpate if she has any organ enlargement, right? No, everything's good. Now we're gonna assess the urinary system. Because Jessica has the Foley catheter, so we just assess the urine from the urine bag. All right, see what's the amount, what's the color and the odor of the urine. And she has a 3,000 milliliter urine per day and light yellow color and no odor. Then we assess the insertion side of the catheter. All right, let's see if the insert side have any redness, any swelling, or any drainage that will indicate infection. Then we move to reproductive system. I'm gonna ask, when is your last time you changed your pad? And she said in the morning when she went to the bathroom. And then I don gloves and assess the fundus. Gonna hold it here to assess the fundus. Check the fundus fundal high, and her fundus 1 centimeter above the umbilicus, and her fundus firm and in the midline. And then I checked the pad. All right, the pad showed it's a very small amount of blood and no clots present. Then we check on the injury of the vagina caused by